Bronny James did unfortunately suffer a cardiac arrest recently during a basketball practice, and it's causing lots of parents to question if it could happen to their child. While it doesn't seem that the cause is out to the public in his specific case, we can talk about leading causes of cardiac arrest in young athletes. One of the most common causes in young athletes is hypertrophic cardiomyopathy. Let's learn about it. As a pediatric emergency nurse, I see this more often than the average person and care for patients who are after or during a cardiac arrest. Hypertrophic cardiomyopathy is a thickening of the wall that makes it stiff and harder for the heart to work. For young athletes who have this, during exercise, their bodies are trying to work harder, and so is their heart, which is why the cardiac arrest is more likely to happen during a practice or a game. This condition is typically genetic, and because of this, it's important to know your family history. One warning sign that may be in your family history, even if you don't know everyone's medical history, is that if someone in your family passed away early. If this has happened to someone in your family, you don't necessarily have to know the cause, but bringing it up with your pediatrician may give them an indicator that this could have been something that someone in your family has had. Symptoms for this condition may be subtle, and they may go unnoticed by many young athletes because many of the symptoms to a kid or to a teen that's trying to do their best and work hard at a sport may make them feel like they're out of shape or just not working hard enough. So having a conversation with your kids about these symptoms may help you pick up on something. And if you're worried about them, then you can take them to their healthcare provider. These symptoms include being short of breath, especially with exercise. This is usually out of proportion to how in shape your child is. For example, cross-country runners whose body can handle maybe running 10 miles starts having trouble breathing and dragging around mile 7 or even earlier. It could be a sign that something else is going on. Other symptoms include fatigue, chest pain, palpitations, lightheadedness, dizziness, fainting, a heart murmur. Another symptom could also be swelling, particularly in the lower extremities, the legs, the ankles, and the feet. It could also be seen in the belly or the neck. If you notice any of these, or if you talk to your child and these symptoms come up, please get them seen by a healthcare provider before letting them practice or play again. It may be nothing, but it could save their life. Lastly, if you want to be prepared in the event of witnessing a cardiac arrest, taking a CPR course can be tremendously helpful. Many communities offer them for free. You can do a quick internet search and see where one's offered in your neighborhood, and it could help you save a life.